Causes: crushing, direct violence, indirect violence. Direct violence: crushing of a head under a heavy object, a wheel of a vehicle, compression by free forceps, an object in a motion striking head, brick, bullet, and road machinery, head in motion striking an object, falls, vehicular accident. Indirect violence falls on a feet. Vertex indirect violence may mainly fracture the base of the skull. Ring fracture, it very rarely fracture the vault. Mechanism of the skull fracture: the fracture due to local deformation. A small mass, piece of bone, a small mass traveling at a great speed strikes the head. Cone formation: a small piece of bone is driven inward. Local deformation: a cone-shaped indentation is formed. Cone areas: two distinct areas in the cones are seen at the apex of the cone. Apex of the cone, inner table is stretched. Fracture occurs first here. The periphery horn, outer table is stretched. Fracture occurs first here. Formation of a circular fracture, outer table fracture. A circular line at the periphery of the cone is formed. Formation of a depressed comminuted fracture. Force continuously act, multiple pieces of fracture result with some bend inward. This one, mechanism of skull fracture: local deformation. A small mass traveling at a great speed, as it strikes the skull, outer and inner table are stretched differently. A circular fracture line is formed. If force is less, a comminuted fracture if formed force is great. Periphery of indentation is stretched. Outer table fracture first here. Base of indentation stretched. Inner table fracture first here. Inner table first. Base of indentation stretched. Inner table fracture and the periphery of indentation stretched. Outer table fracture first here. Okay. Next is about fractures due to general deformation. Skull fractured laterally, as in compression between a ground of a and wheels of a car. Horizontal diameter is decreased, while vertical and longitudinal diameter is increased. Skull compressed vertically, as in a load falling upon head. Vertical diameter is decreased, while horizontal diameter is increased. Bulging of the skull bulges. In both cases, skull bulges away from the side of the application of force. So this is the picture. That is skull compression from side to side. Mechanism of skull fracture is such a compression. General deformation. H horizontal diameter, this diameter, vertical diameter V, longitudinal diameter L. So skull compressed vertically, mechanism of skull fracture in such compression, general deformation, horizontal diameter, vertical diameter, and longitudinal diameter. The combination of the two mechanisms, mostly a skull fracture due to combination of two mechanisms. Next is types of the skull fractures. According to the communication, a fracture of the skull may be simple or a compound. The compound skull fractures a cranial cavity. Compound fractures a cranial cavity may contact with the outside environment, increasing the risk of contamination and infection. It happens when there is a laceration over the fracture. or when a nasal sinus is fractured along with a simple fracture, there is no such a communication. Thank you.